Welcome to today's press briefing. We have two doctors with us, Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. They will give you an update on HA situation and COVID-19 cases. Dr. Ho, good afternoon. 2,812 confirmed patients are in our facilities at the moment. 361 of them are new confirmed cases. Among those requiring isolation facilities, 477 are in isolation wards, 199 in second-tier wards. 513 patients are in Hong Kong North Lantau Hospital, Hong Kong Infections Control Center, and 223 in the Treatment Center for COVID in Asia World Expo. 240 of them are new patients. We also reported 11 more patients in critical condition as of yesterday, 11 in serious condition. And among the confirmed cases in our facility, there are 49 in critical condition and 58 in serious condition. 10 patients in critical condition are receiving intensive care. Death cases. We reported 6 more death cases, comprising 2 males, 4 females, between 73 and 95 years of age. 5 of the deceased did not complete the 3-dose vaccination regime, as these patients were elderly people with chronic illnesses. And after coming down with COVID, most of them had pneumonia and other complications resulting in their deaths. 377 patients have recovered as of yesterday, including 335 being discharged, and 12 patients have tested positive via hospital admission screening, and 18 patients sharing the same wards were listed as close contacts. For HA staff, we have 142 more staff members testing positive, and 62 more members have returned to their positions. Nabat Pok Ngoi Hospital, one 86-year-old male patient in medical and geriatric ward tested positive for COVID on the 13th of September. And upon contact tracing, the hospital found 3 more patients testing positive. They are 3 male patients aged 66 to 90. The 4 confirmed cases are now put under isolation. They're in stable condition. The ward has suspended receiving new patients and visiting arrangements, and the ward has also been cleansed and disinfected, and will continue to investigate the linkage. I give the floor to Dr. Au. Thank you, Dr. Ho. I'd like to give an update on COVID cases as of yesterday, 14th of September. We recorded 8,023 local infections, including 2,320 PCR positive and 5,700 RAT positive. 164 imported cases were also recorded yesterday, including 148 PCR positive and also 16 RAT positive. We also received 6 death reports, as mentioned by Dr. Ho yesterday. And so far in the 5th wave, we have recorded 9,623 deaths. And among the 164 imported cases, 58 were picked up at the TSCC at the airport. 64 came from specimens collected at the quarantine hotels or quarantine centers. For the remaining 42 cases, they tested positive at the centers. 36 of them came from specimens taken on the 4th to 7th day, and 6 specimens taken 7 days before. They were imported from 38 countries. There are 6 countries importing more than 10 cases, including UK, US, Thailand, India, and Singapore and the Philippines. And the remaining countries have imported fewer than 10 cases. As of yesterday, 11 more RCH have reported new cases. There are 8 RCHEs involving 13 residents and 1 staff, and 3 RCHDs involving 1 resident in each of the 3 homes. Altogether, 88 residents in these 11 homes are listed as close contacts, and they'll be subject to quarantine. 1 is in Wan Chai, 香開清確電社 Buddhist 佛教李嘉誠 Elderly Home, 1 resident testing positive. In 旺泰仙港泰護老中心 2 residents positive. The third one in Kowloon City 大眾護老中心 2 residents positive. In 屯門基恩護理安老院 1 resident positive. In Eastern District 騰達護老中心 bracket Sharkey 1 resident positive. In 觀塘 Evergreen 其泰護養院 cum daycare centre 1 resident positive. In Eastern District 日霞軒 1 resident positive. In 優村網窩欣居 4 residents and 1 staff member testing positive. As for the 3 RCHDs, they recorded respectively 1 resident testing positive. Yanchai Hospital, the 35th Board of Directors in Qingyi, Qing Fuzhou Sukse, is a hostel, Chongqing Hostel. And then New Life Psychiatric Rehabilitation Association in Tuen Mun and another in Tuen Mun, Yaozhuang Jiga. As for schools, today we received 1,064 reports from schools, including 893 students and 171 teaching staff. 664 schools are involved, including 129 kindergartens, childcare centers, 292 primary schools, 229 secondary schools, and 14 special schools. Regarding schools making reports to us this morning, in the past 7 days, 481 schools reported more than 2 cases to us. And among these schools, some classes in the 12 schools had clusters of cases. There are altogether 13 classes, and we have advised them to suspend these classes. 3 are kindergartens, 1 primary school, 1 secondary school, and 1 special school. As for schools subject to suspension of classes, as announced before, there are 17 more classes subject to suspension. As a gene sequencing analysis, according to the Public Health Laboratory Service, 79.6% of the cases carried the L45R strain that's similar to the day before. So percentage-wise, BA.5 now accounts for 7.45% of all cases, BA.4 9.15%, BA.2 12.13.7%, and the remaining BA.2.2 16.7%. As we have observed in the past month, there's been a surge in the number of cases of BA.5.5, but it is now tapering off, and despite reaching a high level, in the short term, it could reach the peak. Now, between the 2nd and the 15th of August, BA.4.5 had a 240% increase. Comparing to the previous fortnight, 16th to 29th of August, the climb was 121%. Now, in the most recent 2 weeks, 30th of August to 12th of September, BA.4.5 only jumped by 32.4%. There have been discussions whether coronavirus is a mild disease comparing to influenza. And in fact, we can do some comparison in terms of fatality rate, whether COVID is as mild as seasonal flu. Fatality rate is indeed one of the indicators. And if we are to compare the fatality for the 2 diseases, we need to use the same yardstick, and the Center for Health Protection provides yearly statistics on seasonal influenza as well as COVID. Since the start of the epidemic, or rather since the start of the 5th wave of the epidemic in the beginning of this year, over 9,500 deaths have been recorded. So the fatality rate is about 0.6%. If we consider the average fatality rate for seasonal influenza, 0.1% in the past few years, this would be a reliable comparison. And some believe that the Center for Health Protection's statistics should exclude the most severe period of the fifth wave, and that's February and March, and instead comparison with seasonal influenza, that 0.1%, should be made using just the recent few months in the fifth wave. That's also 0.1%. We don't think it is right. In January, the subvariant in circulation was BA.1, and then we had BA.2.2, BA.12, 2.12.1, and then BA.4.5. As in recent months, there is no empirical evidence to suggest that the BA.5, BA.4 substrains in circulation are milder than the previous subvariants. So if we only take a snapshot for a certain period of time for comparison, it would be misleading. Because of the various measures adopted by the government, the fatality rate in the fifth wave dropped at one point. That's due to vaccination rates as well as other anti-epidemic measures introduced. Hence, we cannot compare the severity of the two diseases using a few months as the basis of the period for comparison. And we must not use a snapshot of statistics to compare the severity of a seasonal influenza, as there will be mutation at different stages, causing different levels of seriousness of the disease. At the moment, we still believe that COVID is more serious than in seasonal influenza, taking into account a number of factors. First, COVID is more transmissible than seasonal flu, especially Omicron. At this peak, the rate could be 5, and in fact, in the beginning of this year, the real-time reproductive number of the Hong Kong U reached 5, so it's much more transmissible. In the past 2 or 3 years, the social distancing and anti-epidemic measures helped our community guard against seasonal flu, but not COVID. And that proves the high transmissibility of COVID and the high number of infections comparing to flu, and correspondingly, the fatality rate would increase as well.
Secondly, COVID-19 is more severe compared to flus, especially for those who have not been vaccinated. In the fifth wave, we have recorded more than 9,500 death cases. 8 cases involved children. So compared to flu, over the past few years, annually from 2015 to 2019, the annual death rate ranged from 211 to 812. So the number of deaths related to COVID is many times more. And also COVID can affect children, and every year it ranges from 1 to 5 in terms of death cases involving children. And for elderly people, COVID death rate is quite high among elderly, particularly those who have not been vaccinated. Those aged 80 or above, the overall death rate involving COVID is up to 8.46%. Those who are not vaccinated, aged over 80, the death rate is up to 14.7.5%. Right now, there is a number of elderly people in our population who are aged above 80 who have not even got a jab. The latest figure is 116,000 people aged 80 who have not received any jab. And that makes up 29% of the particular age group. For children, Hong Kong U earlier announced a study on a number of hospitalized children aged from 0 to 11 who, because of flu, COVID, needed to be hospitalized. And more than 1,100 cases of children were admitted in February because of COVID. And they found that compared to flu, the COVID children cases, among those children infected, those with complications was up to 15%, compared to 8.4% among flu cases. And also those with croup, children infected with COVID is 5.3% compared to 1.9% among the flu patients. And so the hospitalization rate is also higher among children with COVID. Death rate for children is 0.2%. For flu is 0.1% among children. So therefore, you can see the higher impact on children among those infected with COVID. And a large number of those hospitalized among children, actually in Hong Kong, up to 180,000 children have not received any vaccination. So we need to increase the coverage of vaccination. And also, for those who were infected early this year and who experienced immunity for the short term, and that also led to a drop in the death rate from May onwards. But there's still a large number of people infected previously who have not been vaccinated. And the immunity would wait as time passes. So that means that the risk of infection will increase in the days ahead. And also COVID infection could lead to long-term side effects, that is long COVID. 3 to 6 months after their recovery, for some people, they may still have lingering symptoms like being tired, headache, shortness of breath, muscle pain, or even impairment of their cognitive abilities. So you can't really compare COVID infection with flu cases, because flu, you wouldn't suffer long-term side effects as a result of that. And WHO says that the chances of people with long COVID symptoms ranges up to 20%. And also, WHO's European office published a paper recently citing a mathematical model which suggests that globally, 145 million people who have recovered from COVID have experienced long COVID symptoms, and CUHK estimates that 76% of the recovered patients in Hong Kong would, within a 6-month period, experience long COVID symptoms. And also, the COVID-19 virus would result in or lead to new variants. So that's different from what happens with flu. So for COVID, over a period of time, there may be new subvariants coming up and dealing a blow to people's immunity. And flu and COVID-19 infection are two different diseases. So we're worried that every year when winter comes, in Hong Kong as well, there is seasonal flu. But if COVID and seasonal flu happen at the same time in the same period, then people infected with both conditions could increase, and the chances of death or having severe conditions, severe diseases, could also increase. And among the highest risk populations, COVID-19 is not a mild disease and it could lead to death. So we're going to launch a seasonal flu vaccination program, and we encourage the public to receive the vaccines to counter flu. And last, I want to make an appeal. The SAR government earlier on has set up a WhatsApp hotline to answer public queries about COVID-19. The number is 9617-1823. 9617-1823. That's the WhatsApp hotline. The public can, through WhatsApp, have interactions with us and also receive information related to COVID-19 infection. And our colleague in the OGCIO has enhanced the function of the WhatsApp number and also can allow it to provide more detailed information, including giving actually information on the electronic bracelets, Leave Home Safe app, and testing, virus testing, and also the latest information on the COVID vaccines. So the public can try to find answers to the queries by typing in the WhatsApp number. And the hotline number of the Department of Health has received a number of inquiries, more than 100,000 inquiries every day. We know that some people may not be able to call the Department of Health hotline successfully. So today, the Department of Health has also added an interactive voice system, which has the function of giving people options of information they want to look for.
The floor is open. Please introduce the media outlet you represent. This lady on the side. Good afternoon. I'm from TVB. First, as Dr. Ao just now mentioned, there is a WhatsApp hotline after an update, but at this moment, we see the figures dropping from the peak slightly. Is it a bit too late? And Dr. Tedros of World Health Organization expresses that the number of infections of COVID have come down to a very low figure, and this could mean the end of the pandemic. Now, does the CHP agree with the World Health Organization? Does it apply to Hong Kong that the pandemic is coming to an end? And a BA.5, as you mentioned, the percentage now stands at 70%, but about a month ago, according to some experts, if the percentage of BA.4.5 reaches 70 to 80%, that means the figure has peaked. So would you say that judging from the current situation, we are coming down from the peak? In terms of the latest epidemic situation in Hong Kong and the trend, we have observed that starting from Tuesday, when we recorded 7,200 cases after the Mid-Autumn Festival, the figure has increased to 1,000 cases to 8,000 a day. The previous drop could be due to fewer people going for testing during the Mid-Autumn Festival, and there is a slight increase in recent days, and we need more observation. And we believe that more cases may emerge as more people become infected during the holiday. So we need to observe for a longer period of time. And it is difficult to gauge the epidemic situation and the trend on the basis of just a week's figures, whether it's still an upward trend, whether it's a plateau, or whether it's a downward trend. We need a longer horizon to assess the trend. Now, according to sewage surveillance, this indicator has dropped as well. The latest figure shows that there are about or close to 400,000 copies per liter of sewage. The Hong Kong U indicator also drops to close to 1. So we are quite optimistic about these indicators. At the same time, for those who had been infected between February and April this year without further doses of vaccine, their immunity level would drop. And if they haven't been jabbed to complete the regime, they would have a higher risk of infection. So we urge them to get vaccinated as quickly as possible. And about the Director General's of World Health Organization's comment, I note that he is urging all countries in the world to work together to boost vaccination rates and race with COVID so as to reach 70% inoculation rate. When we have a higher rate of vaccination, this would definitely ease the pandemic situation, and the number of global infections would drop. And Hong Kong is heading in the same direction. If we have sufficient vaccination, the risk of infection and severe death cases would be minimized if we could all get the good vaccination coverage. Now, for BA.5 in August, we noticed a rapid surge. In just 2 weeks' time, the figure surged by 200%. Now, BA.5 accounts for 70% of all infections. The rate of increase has slowed down, but we need to further observe whether we have reached a plateau. According to World Health Organization's latest figures, over 90% of the subvariant in circulation is now BA.5. So it is possible that BA.5 would take up the largest percentage of cases. Of course, we need to observe whether Hong Kong situation would be the same. As for the interactive voice system, again, we're not sure whether the epidemic trend is coming down or not. And we have made an update because we've noticed that there are many calls coming in and many callers find it hard to have the line put through. So instead of manually taking calls, we believe that members of the public can use the interactive voice system to get the information they need. So it's about enhancing efficiency. Next question. This lady on the right-hand side. I'm from Now TV. Good afternoon. Again, on comparing COVID and flu figures, you said it's not appropriate to use the COVID situation after May. Now, when there was a major Omicron outbreak in the beginning of this year, the vaccination coverage was not good. The community did not have good immunity barrier. But after May, when the vaccination rate has improved, the situation became very different. So if you take the whole period of the fifth wave as a basis of comparison, wouldn't it be inappropriate? What is your professional judgments as doctors on the change in the immunity barrier? So is it the CHP's practice to use the period of the whole fifth wave for comparison? Now, yesterday you mentioned a school, all classes of which have to be suspended for a week, and that's Jiang Wing-chi Secondary School. Are there new cases? Have you identified the route of transmission? And you also mentioned some classes of seven schools being suspended. Are there similarly outbreaks in these schools? Thank you for your questions. About fatality rate, the number of deaths for COVID and flu. We're talking about two different diseases caused by two different strains of virus. For seasonal flu, the fatality rate, as mentioned, is 0.1%, but we must not look at just a particular strain of seasonal flu in a particular season. The 0.1% is an average widely adopted in the world. Sometimes, despite the 0.1% in fatality rate, there might be more infections involving elderly and children. But for another strain in another season, there may be more elderly people being infected and a higher fatality rate. So depending on the subvariant in circulation and the season, the figure may be different. Hence, we must not judge the severity of a disease simply by one figure. Likewise, for COVID, when we gauge the severity of COVID, we need to consider the changes over time and also the different epidemic measures adopted, especially, say, in February, March, after a major outbreak in the fifth wave. Many people have been infected, and if they got vaccinated afterwards as well, they do have a very good protection. But on the whole, we need to consider the epidemic situation in general, and that is why we would look at the situation with a longer horizon. For the fifth wave, since the beginning of the year, the Omicron strain has been the most widely circulated virus. So we should look at the related figures. And of course, we have also analyzed the fatality rate after May, and indeed there has been a drop. But this is mostly due to increase in vaccination coverage, together with social distancing measures and other anti-epidemic measures. However, there may be changes. In winter, there may be a new subvariant, and the situation may be very different. And there may be immune escape as far as the prevailing vaccines are concerned. As for schools, yesterday we announced a secondary school, Chi Secondary School, and the whole school has been suspended. But this morning we received another report from the same school. Because the students are not required to go back to school, the students might not have taken RAT. Now, 53 infections were recorded yesterday. That's about 5% of all students. And as a precautionary measure, we have asked for the school to be suspended. As for 7 other schools, previously, we have advised some classes in these schools to be suspended. Now, 1 more class will be suspended. We haven't noticed major outbreaks in these 7 schools. The overall percentage has not exceeded 5%, but we'll keep in view the situation.
On the left, gentleman in the back. Good afternoon, I'm from Ming Pao. I want to ask Dr. Al about the death rate. I've noticed that by May 1st, for the 5th wave, the death rate is 0.76%. A few months later, now it rose to 0.6%. So, this changes in the death rate and the 0.6% death rate, do you think is reliable in comparison to making it as the basis for comparison with flu? Is that correct? And also, you said that there could be changes in Omicron variants. So recently, any death rates recently were related to BA4 or BA5, and the death in terms of the death rate, if you compare that with that of BA.2.2. And also, you said that Hong Kong is trying to drive up vaccination rate. WHO announces its latest goal for vaccination. This paper says that the highest risk group, that is elderly people, medical workers, should be vaccinated as much as possible. And youth will be the lowest risk group. Do you agree with that priorities? And what is the future strategy for Hong Kong's vaccination? Is it to focus on driving up vaccination rate for the old and the young? Or for the death rate, it is a floating figure, I have to say. As time goes, with new cases, among the new cases, there would be new death cases. And so we look at that on a cumulative basis. This is from the start of Omicron, we would work out the death rate on a cumulative basis. Previously, it was 0.7%. In recent months, among the recent cases, the number of death cases dropped. The reasons I just explained just now. So that led to the overall mild drop in the death rate. But that can be interpreted as an average death rate. From early this year till now, of all the cumulative cases, right now, is about 0.6% in terms of the death rate. For your second question on BA5, and its link to death cases, we have done some preliminary analysis in the local cases involving BA4 and BA5. On May 1st from that to September 12th, 54 cases were related to BA4 or 5, making up 0.1% of BA4 or 5 related death cases. BA.2.2 in comparison, that is the variant that prevailed early this year. Well, this variant is still being spread. There are 32 cases related to death rate among local cases, which made up 0.08% of the overall death cases linked to BA.2.2. BA.5 actually appeared only in the past 2-3 months, so we only have the recent figures in relation to that variant. As for vaccination, we encourage people of all age groups to receive jabs. That is to protect themselves, and should they become infected, they will not develop severe diseases, and also have a lower chance of actually being dead. And also after vaccination, it would help prevent transmission of the virus, and also the person vaccinated can recover more quickly as well. We're particularly concerned about the old and the small children. Many figures have shown that once infected, the death rate or the need for hospitalization or developing severe conditions are pretty high among the infected elderly people. And also, healthcare workers are an important group because they need to protect themselves so that they can serve the patients. And also, staff at residential care homes are an important group. And we have figures also showing to us that once children are infected, they might develop serious conditions, for example, complications, croup, or pneumonia, or brain problems, and so forth. And there also could be death cases involving children. Right now, the vaccination rate among children is low, so we are worried about that. In Hong Kong, our overall direction is that we hope that the public vaccination rate can go up, particularly raising the percentage among the elderly and small children, so that the overall population in Hong Kong can have much bigger immunity. Any other questions? Gentleman at the back on the left. AM 730. Just now, doctor said that the comparative death rate should be based on the entire period when Omicron prevailed. But since May, including the relaxation of social distancing measures and changes in the virus strain, situation had changed. If you look at the situation of cases in May as one of the factors used in working out the death rate, do you think that's appropriate? And do you think that the figure of 0.1 is that meaningful? And also in ramping up vaccination, the government keeps emphasizing that those who have not received any jabs should receive vaccination. But what percentage of vaccination rate you think would be enough, you think, to let the public know that we have seen results of your efforts? And also, HA, do you have the latest figure on people who die of COVID? That is during the fifth wave. Thank you for your question. As I said just now, for the death rate, the analysis of death rate, if we compare that of COVID with flu death cases, we cannot just extract the figures from a few months as the basis of judging whether what the death rate in relation to COVID is like. We need to look at a longer period of time to come to a more proper conclusion. And Center for Health Protection has been monitoring the situation. Even for flu cases, we not just look at the death cases for 1 quarter alone to work out the overall death rate of flu. But as time changes, of course, there could be new variants that come up. The death rate could also vary as a result of that. Like when the Delta variant was being spread, well, compared to Omicron, Delta did lead to more death cases. So if you look at the effect of Omicron on the fifth wave, we should include the number of cases from early this year. And we have seen that since May, among the infected cases, the death rate compared to the previous months dropped. But in the days ahead, as the public's immunity decreases, even after infection, and if they remain unvaccinated, they could be reinfected with BA4, BA5, or new subvariants. And by then, what would be the death rate? We cannot make any predictions now. So we think that we should use the figure over a longer period to work out among the infected community what the death rate could be. And your second question about vaccination, We encourage people to be vaccinated as much as they can. We don't have a target on the ideal percentage because we are looking at the overall protection for the society and individuals. As long as someone remains unvaccinated once he's infected, it's possible that he could develop severe conditions, diseases, or resulting in death. We don't want to see that. We hope that everyone can receive jabs, particularly among the elderly and the small children. And figures show that among the small children and the very old, the death rate is high. And their vaccination also tends to be low among those age groups from 6 months to 2 years old. 85% of the small children have not received any jab, and elderly age above 80, 29% of them have not received any jab. So we're concerned about that, and we hope that the entire society can work together in ramping up the vaccination rate.
Regarding the death cases in the fifth wave, we are conducting an analysis. We're collating information, including vaccination history and underlying illnesses of the deceased patients and those refusing resuscitation. We're still processing this information and we'll make due announcement when we finish. The majority of death cases in the fifth wave involved elderly patients, and many of them did not have vaccination records. Of course, we also need to check whether these patients died of COVID or died of their own underlying illnesses. If there are no other questions, that's the end of the briefing.